then what you have to do is, okay, I can start. Okay, so see, basically we are here to learn pharmacology. Like we'll be starting it. So before starting, I would like to give a small brief, like a small introduction. And this introduction is just a minute. हाँ ये पेन कैसे स्टार्ट होती है? Okay, so what is pharmacology? So the term pharmacology is made up of two words, the pharmaco and logy. Now this term pharmaco is a Greek word which means drug. Okay, and logy, we all of us know that it means science. So it is basically the science of drug. Now what is drug? Now they can ask us this question, the definition of drug. Now, you know what? This term drug has been derived from a French word which is basically drogue. And drogue means what in French? It means a dry herb. So, according to them, drugs are what are dry herbs. Okay. Whereas if we talk about WHO definition of drug, that what is drug, then WHO says that drug is nothing but any substance or product that is used or it is intended to be used. Either you are using it or you intend to use it. Okay, and which can modify or explore the physiological system and pathological state. So I will write that thing. See, drug is nothing but it is any substance which either we are using or we intend to use, and it can modify. What it can modify? It can modify the physiological system. Now we know there are multiple systems, isn't it? So it will either modify the physiological system or the pathological state. Now whenever what happens, this physiology, when it gets whenever there will be any kind of abnormality, we call it pathology, right? So either this drug, this substance will modify the physiological state or the pathological state. So that which can do this is drug. Okay, and while doing this, while modifying either the physiological state or the pathological state, it should benefit the recipient, then it is called as drug. So this is a definition of drug. So first point of today was, what is the definition of drug? So according to WHO, I'll repeat, it is any substance or product that is used or is intended to be used, that can modify or explore the physiological system and the pathological state, and it is beneficial for the recipient. Okay, so this was the first point. Now the thing is, what happens, let's suppose that this is a human being. Okay, and this human being has taken a drug. So now, if let's suppose this is drug, I will say it D, and this is body, human body, so we can say B. So this pharmacology is nothing but studying the interaction of drug and body. So what is pharmacology? Nothing but it is the study of interaction of drug and body. Now, if two people are interacting, then what are the chances? There are two chances, right? What it can be, either we will study what the B is doing to D or what D is doing to B. So there are two chances, right? And these two things are basically the part of pharmacology that we know as pharmacodynamics or pharmacokinetics. Now, how to remember what is dynamics and what is kinetics? Okay, so dynamics is, if D, when D comes first, it is dynamics. What D is doing to B, then it is dynamics. Okay, so this is pharmacodynamics, and what B is doing to D, the rest one, it will be pharmacokinetics. Okay, I hope it's clear that what is pharmacology. Pharmacology is nothing but the study of interaction of drug with the body. When two people are coming, then we will see what B is doing to D and what D is doing to B, right? So what D is doing is dynamics. That's it. You remember this much only. Okay. So these are the two main topics that we are going to deal today. Okay. Now, before that, we have what till now what we studied? We studied the definition. We studied what is kinetics and what is dynamics. Basic. What is kinetics? What is dynamics? Now, before going into kinetics and dynamics, there are certain points which we should know. They are important. If we talk about examination, they are important. Like in previous year, there was a 5 marks question from this topic, that was drug form. Dosage form. Okay, so now let's deal with that. Now what is that? Let's see. So see what happens. Let's suppose now I said there are two people, the body and the drug, and we are going to study the interaction. So how this drug is going to come? Definitely there will be administration, right? When we are going to administer it. So this administration can be of two types. Now what is this administration? Either the administration will have the dose, we will say either dosage form or route. Whenever we are talking about administration, either we will say that what dose you are giving, or in what form you are giving, or through what you are giving, isn't it? Whenever we are about to say that okay, I'm going to administer this drug to this person, so I have to tell that what will be the route, or else what will be the dosage. Okay, so this question, this drug dosage form, was a 5 marks question in in previous year. So let's deal with drug dosage form today. Okay, so now what is drug dosage form? So it's by itself. Is there any doubt? Okay. Okay, so drug dosage form. If we are talking about form, a form is nothing but in which a drug or formulation can be administered to a patient. We know what is form. Form is nothing, either it is solid, liquid, or any other form, right? So similarly, this form can be divided into three. It can be either solid dosage form, it can be liquid dosage form, or another one is it can be a dosage form for external application or external use. So we have to keep this thing in mind, that drug dosage form is of three types. One is solid dosage, another is liquid dosage form, and the third one is a form which can be used externally. Now another thing is, what are solid dosage form? So solids are, we all of us know, like it can be either capsule or tablets, right? So capsule and tablets we know. Now another thing to remember is peg. Peg is solid, so we should have a solid peg. So what it is, solid dosage form will be either capsules or tablet, that we know already. What we have to remember is peg, a solid peg. Okay, now what is PEG, peg? So it is either powders or effervescence, that is eno, etc., or it can be granules. Okay, so these are the forms. Now what we have to do is, in our syllabus it has been given that we have to read, in question paper basically it was given that we have to write each dosage form with an example. So we'll be seeing what are the examples and all. Okay, so first if I talk about capsule. Now while we are hearing this term capsule, one important thing that should come to our mind is gelatin. Okay, what is that? Gelatin. Now what is gelatin? We know it's an inert substance. Okay, it is not going to interact. Now we will see, in the further class we will see what is an inert substance in a drug, what is an active substance in a drug, and why these inert substances are important. We will be seeing that. Okay, so gelatin is basically what a covering is there of a gelatin, and the drug is there, isn't it? So capsules are what? Gelatin. You can give any example in it of any capsule. Okay, either you can give of calciferol, that is vitamin D3. we know there are capsules for it. Okay, now if I talk about tablets, what are tablets? Tablets are nothing but any powder or any granule. Okay, any powder or any granule, when we give a very high pressure, under a very high pressure, it will form either it will form a tablet, it will be punched into a tablet. Now tablets are of different types. Now this is a very vast thing. Like tablets are of almost six types of tablets are there. We will see it quickly. What are they? So the first one is ordinary tablet. What is ordinary tablet? Nothing is there. Simple powder which has been pressed. That is ordinary tablet. No coating, nothing. An example is aspirin. Aspirin. I hope we know, all of us know what is aspirin. Now, the second one is sugar coated tablets. Now, we have sugar coated tablets. An example for a sugar coated tablet is chloroquine, a medicine which is given in malaria. Okay, so sugar coated tablet, that is chloroquine. The another one is film coated tablet. We have another one which is film coated tablet. Now what is this film coated tablet? Why it is made? In order to avoid unpleasant taste. Okay, in order to avoid the unpleasant taste, we are making this film coated tablets. Now another type of tablet is enteric coated. Now what is enteric coated? This is very interesting. Now what is enteric coated? It is like, let's suppose that you are taking any tablet, and that tablet is not getting absorbed in the stomach, but it will be getting absorbed in the intestine. So it is going to basically avoid that, what, the pH level, the acidic pH won't work, but the alkaline pH will be working. So that is shellac or keratin. Like the coating is done by shellac or keratin, and then this tablet works like that. An example is very common one, all of us know, that is diclofenac, which is a painkiller. Okay, so enteric, it is an enteric coated tablet. Enteric coated, the term itself say enteric, we have to think about the gut, and the what we have to think, that it is not going to act in the stomach, but it is going to act in the intestine, in the alkaline pH. Okay, so the another one is long retard tablet. Now what is a long retard tablet? The term itself is telling that this tablet is going to there for a long time, isn't it? So that's why it is called long retard tablet. Now how is that possible? Now what happens is, let's suppose, now we know what are tablets. Tablets are nothing but some powders are there, and these powders are pressed into high pressure. So what happens, let's suppose this is the churna, this is the powder that I have. Okay, now I have granule number 1, 2, 3, and 4. Now what I'll be doing is, I'll be coating these granules into different layer. Why? Because let's suppose that one has been coated by one layer, the second one I am coating by two layers, the third one I am coating by three layers, and the fourth one is getting coated by four layers. Okay, so what does that have, what it will do? It will be slowly removing the coating, and then the drug will be acting. Let's suppose the first coating was removed easily and it was acting for the first hour. Now the second one will be removing after the second hour. So like this, it we can go up to 10 to 12 hours. Like this drug can act up to 10 to 12 hours. Now there are drugs like I said, diclofenac in painkillers, in enteric coated. There are also examples of diclofenac SR. Okay, this is basically a long retarded one. And metformin SR is also a long retarded one, that we know, we give it is mainly given in type 2 diabetes. Another one is propanolol. Propanolol. It is given mainly in HTN, like that is hypertension. Okay, so this is how this long retarded tablet is acting. Now if we go further, the another last type is lozenges. We all of us know, like we know this Vicks and strepsils and all, these are lozenges. What happens, we are taking the powder, we are adding sugar to it, and then we sometimes gums are also added, so that it is like it will get the person will be chewing it, and it will produce a local effect over there. So the another type is nothing but lozenges. Okay, the another will be lozenges. I think my pen got discharged, so I can't write. So the another type is lozenges. Okay, so these were, I'll just repeat what we studied till now. We were studying about administration. Administration is what? Drug dose. It will be two types, right? Either which form I am giving, or I have to think of what route I am giving, right? So now we are discussing about drug dosage form. What is that? It is of three types: either solid dosage, either liquid dosage, or a form which can be given externally. Okay, in that we discussed about solid dosage form. Now solid dosage form, we know solids are tablets and capsules, so we remember that, but we have to also remember a solid peg is necessary. Okay, and what is peg? Powder, effervescence, or granules. In Okay, and then further we studied about capsules. That what are capsules? Nothing but gelatin coated ones. Example we give of calciferol, vitamin D3. Okay, another one we talked about tablets. Now for tablet, what are tablet? Tablets are nothing but powder or granules which are highly pressed and formed into a like a tablet. Okay, now tablet are of six types. Ordinary one, which is having no coating, only powder, and the example was aspirin. The another one is sugar coated one. The example is chloroquine. Third one was film coated. Why we are coating the film? Because of the unpleasant taste. You can give any example. Enteric coated. What is enteric coated? Which is not working over the stomach pH, but it is acting at the this intestine pH. Okay, the example which we gave was diclofenac. Then long retarded, how it is retarding? Because each granules are coated in different layers. So what happens? It takes time to just remove it. Okay, so and the last one was lozenges, that we know the this substance, etc. So tablets have been done. Now we will learn about powders. Now we know what are powders. It's nothing but a dried and finely pulverized form, isn't it? Example can be given of boric acid. Okay, so boric acid is an example. Now another one is effervescence. Effervescence powder are nothing. This was discussed by Kiran sir also in class, that it is nothing but sodium bicarbonate is there and citric acid is there. Okay, so and the example is what? Eno, or even there are a certain disperine can be also taken as an example. Yeah, these two example was given by sir itself. So granules, what are granules? Granules are nothing but small aggregates of the powders, and this was also discussed. So I hope that solid dosage form is well clear. Okay, now the another form which we will be dealing is the liquid dosage form. Now what is liquid dosage form? It's understandable, isn't it? It will be in liquid form, that's it. So what are the parts? There are three parts. First one will be aqueous solution, which can be either a syrup or injection. The second one will be drops. Okay, and the third one will be enema. Now what is aqueous solution? Either syrup or injection. What are syrups? Syrups are nothing but we are adding sugar and flavoring agent. An example can be cough syrup. Okay, now another one is injection. Injections are nothing but sterile solutions. Why sterile? Because we are giving through a parenteral route, isn't it? Example can be xylocaine. Okay, now drops. If we are talking about drops, there are vitamin drops, there are eye drops, multiple drops are there, isn't it? What are these? These are highly concentrated solutions. Okay, that's why we are giving in a minute dose, still it is effective. Now enema, it's nothing but rectal administration is done, and what it helps? It helps in the evacuation of the colon. Okay, soap water can be an example of enema. Now the another one is which can be used externally, the third part of the drug dosage form. The third part is one which can be used externally. So the examples are liniments. Now what are liniments? These are basically when applied on the skin, we have to rub it. Okay, we have to rub it, and these liniments are the vehicles, we can say, are nothing but oil or soap. Okay, so there are camphor liniments which act. Okay, mostly camphor is common in liniments. Another one is lotions. Lotion are nothing but liquid medications for local applications like zinc, calamine, etc. The third one, ointments. Now ointments are what? They are greasy base which will be having paraffin like thing. thing, okay, the waxy paraffin like thing. Example is soframycin skin ointment. The fourth one is plaster. Plaster is what, it is a resinous, like it has resin base and it can spread, like mostly the available plasters are zinc oxide plasters. Okay, the fifth one is gels. What are gels? It is basically gelling agent is there, and there are contraceptive gels available. Okay, so what are, another is inhalants. Inhalants are nothing but the nebulizers which are used. And then aerosols. Aerosols are what, liquid is there. Okay, let's suppose I have a water, I have 10 ml of water, then I'll be putting gas under some pressure, and that will be converted into this vapors and it can be taken. Okay, so these aerosols particles are made. The example is salbutamol. Okay, so these are the example of dosage form taken externally. One more example is there, suppositories. Now suppositories can we there are three important terms. Suppositories, one is pessaries and bogies. Now, so what is suppository? It, we know that rectal insertion is done the way, and it is of bullet shape. Okay, the suppositories are of bullet shape. The common example is Delcolex. What are pessaries? Pessaries are of conical shape, and these are the used in vaginal insertion, whereas suppositories are used in rectal insertion. Okay, then bogies. Bogies are used for urethral insertion, and they are of pencil shaped. The last one is transdermal adhesive patches. So what is that? A drug will be there, a polymer will be there, and a adhesive plate will be there. So these are the form through which we can give like administer drug, yeah, we can administer drug. So these are the forms. I hope that these forms are clear very well. Is it clear to all of you? Just give me thumbs up. If I'm very fast, just let me know. Is it clear? uh, uh, okay, okay, okay. Okay, so we have completed a 5 mark question, that is drug dosage form. Now let's move on to another part, that is routes of drug administration. This is also an important topic, and there can we can expect a 5 mark question from this also, that is route of drug administration. Now I said whenever I'll be thinking of giving a drug to someone, either I have to think of the form, or I have to think through which part I am going to administer the drug. So the another part of administration is basically the route of administration. So how we are going to give that drug is the another part. Now, we know there are three routes of administration. What are they? It is enteral, parenteral, or topical, isn't it? Enteral, parenteral, or topical. Enteral is what? When it is given directly into the GIT. Okay, so there is a short trick which we can remember, that is ORS. Okay, so in enteral, there is no trick needed. It is very simple. Either it can be through oral route, or it can be through rectal route, or it can be sublingual. That is definitely oral, but the type of absorption changes, like the way of absorption changes. Okay, so enteral is nothing, ORS, that is oral, rectal, sublingual. Okay, now what happens in enteral? The drug directly goes into any part of the GIT. So in this part, what we have to do is, they expect us to write the merits and the demerits of each of the part. So we'll be just discussing and going. Okay, so in oral, now we can write many benefits, many merits. And what are those merits? Either it is safe, right? It is painless. What else? It is having no assistance is needed, like we don't need anyone to give that drug, isn't it? Similarly, we have multiple merits which we can actually write on our own. So that is the thing. Now what are the demerits? Now one of the very important demerit is there, which I want to discuss. Okay, and by learning that, we can understand how the drug act also. Okay, so here we are talking about enteral, right? So enteral route is ORS. So oral, if we are talking the merits we know. Okay, multiple merits are there. It is safe, it is painless, we don't need any assistance, and blah blah blah. Whereas if we talk about about demerits, it is slow acting. Why? Because we are expecting the drug to go into GIT, then we are expecting it to get absorbed, then get distributed, and then get metabolized and do some action. So definitely it is slow acting, as well as it is unpalatable. If it is not tasty, then definitely we don't like to take the medicines, right? And sometimes what happens, it is destroyed by the the GIT enzymes and all. Okay, this thing is there. Now, it the most important part is that first pass effect. I want all of you to be focused. What is first pass effect? Okay, because the drug gets destroyed by this first pass effect. Now, what is first pass effect? Like, see what happens. Let's suppose, I'll be just drawing. Let's suppose there is a person, okay, and this person, this is the mouth of the person, and this is the oral part, and this is the fecal part, and these are the cells, and then we have a liver over here. Where is the liver? Yeah, this is the liver, this is the portal vein. Wait, let me draw it properly. Yeah, this is the portal vein, and this is the systemic. So this is portal vein, this is oral, this is fecal root, and this is our liver, and this is, we can say, the rest of the circulation, systemic circulation basically. Okay, now what happens, let's suppose a person is taking any drug orally. The person took the drug. Now this drug will be getting absorbed into the portal vein. It let's suppose it got like absorbed into the portal vein through the intestinal, yeah, first it came through oral, then went to the stomach, then through the intestinal part it got directly absorbed to the portal vein. Now what will happen, it will go to the liver. So what the liver is going to do, liver has an enzyme called cytochrome P450. All of us know that, isn't it? What it will do is it is going to metabolize and change it, isn't it? Let's suppose that I had a drug which looks like this. Now after metabolism it has been cut it into pieces and it has been changed, and now my drug looks like this, and only less part of it is active, isn't it? So most of the part, what happened, most of the part has been changed, and now that is going to enter into the systemic circulation. Okay, so this is what we call first pass metabolism. Whenever a drug is taken orally, this is going to happen, and whenever this will happen, the bioavailability of the drug decreases. All of us know what is bioavailability, right? What amount of drug is available to do the action, this is bioavailability. So whenever this is going to happen, definitely bioavailability is going to decrease. So this is first pass effect. So let's go back why we discussed that. Because whenever we are going to take any drug orally, because here we were taking it orally, so whenever we are going to take any drug orally, this will happen. What will happen, it will go through first pass effect, first pass metabolism, and it will get the bioavailability will be decreased. So this is one of the demerits of oral administration. Okay, now the next one is the rectal administration. Now what is rectal, we know, giving the medicine through the rectum. Now what are the benefits, the benefits are, it is, even if a drug is unpleasant, we can take that drug, isn't it? Now there is a very interesting phenomenon, what I would like to discuss it here. Let's suppose that this is the part of the intestine. Okay, rectum, basically this is the part of the rectum. Now the upper part of the rectum, this is the upper part of the rectum, and this is the lower part of the rectum. What happens, this is getting supplied by the superior rectal vein, and this is getting supplied by the inferior rectal vein. Now whenever this drug whenever it will come, what will happen, this, the one which is coming in the upper part, will first go to the liver, and we know once the drug reaches the liver is not going to leave it, it will decrease the bioavailability, isn't it? Whereas if this drug reaches to, if it is given in the lower part of the rectum, then what happens? This directly goes into the systemic circulation. Why? Because inferior rectal vein is supplying the blood. Okay, sorry, taking the blood. So systemic, so it will go into the systemic circulation. And once it is going into systemic circulation, what happened? It has avoided the liver. And if it has avoided the liver, what does it mean? The bioavailability won't be reduced, isn't it? So the beautiful thing is that while we are giving any drug orally, there are chances that the drug will have to pass, drug will have to go through first pass metabolism. Whereas if we are giving through the rectum, what will happen? Because the lower part of the rectum is supplied by the inferior rectum vein, so the blood is going to go into the systemic circulation directly, so it will avoid the first pass metabolism. That means the bioavailability of rectal administration will be higher than that of the oral administration. Okay, but there is a demerit. What is that? What will be that demerit? Because there the action may be erratic. What like why it can be erratic? Because of the intestinal contents. Because we know the contents will be there. It won't be as empty as the oral cavity is. Isn't it? So the actions can be expected to be erratic. An example is again Delcolex suppositories which we are giving. Okay, so I hope it is clear very well that why the rectal administration is having higher bioavailability than that of the oral administration. Okay, now the second one, the last one of the enteral is the sublingual. Now, what is sublingual? We know either we are putting the medicine beneath the tongue or between the teeth and the mucous membrane of the cheek, isn't it? So, now what happens in this case? In this case, the absorption of the drug is quick. Why? Why? Can anyone guess how the absorption can be quick? Can anyone is willing to answer how the absorption can be quick? Where it should go to have the quick absorption? Yes, please. Anyone?